Hello, my name is Dr. Revathi Raj. I'm a pediatric hematologist and oncologist at Apollo Hospital, Chennai in India. So we have this beautiful child here who's come from Muscat who had a blood problem which is called HLH. It is a very rare disorder, and the whole point of this message is to raise awareness on several blood disorders that can affect children and what we can do to find a cure for these rare blood disorders. So if you look at blood disorders, you have the bone marrow stem cell, and if that doesn't work, it's called aplastic anemia. You have red cells which are made from these stem cells, and the disorders of red cells are very common in Oman, which is sickle cell anemia and thalassemia, and they need lifelong monthly blood transfusion. There are disorders of white blood cells where the babies are born without immunity, that is called primary immune deficiency, or they can have cancers of white blood cells, which is called leukemia. So these are some of the problems for which we can change the bone marrow and cure diseases and give a new ray of hope to the families. For a transplant, the first basic start is the child should be in good general condition. So whatever it is to make the child in good general condition, we do that. Second step, we need a healthy donor who can give their stem cells to cure the affected child. And for this, we have families who have a matched family donor, but sometimes you can have 10 brothers and sisters and nobody is matched. This, we have families who have a matched family donor, but sometimes you can have 10 brothers and sisters and nobody is matched. Oman and India, there is a lot of marriage within families, within tribes, so the chance of getting a donor is very, very high. But sometimes we can be unlucky and we don't find a donor within the family. Worldwide, there are 25 million donors registered to say, I will be a stem cell donor. But unfortunately, majority of them are white people, Caucasian. So the chance of us finding donors in these registries is next to impossible. So the third option for us is to use a half-match family donor. So this kind of transplant is a novel type. We've been doing them only over the last 5-6 years, but it has changed the way we look at patients, the way we have treated patients, and it's made a huge difference. So a 50% match family donor can also be used as a stem cell donor for patients. This is called haploidentical BMT. Only in this condition we have to choose the patients very carefully. We are not able to offer it for all children, but for certain disorders like incurable leukemia through chemotherapy, in genetic disorders like HLH, primary immune deficiency, the chance of haploidentical donor or half-match family donor working is very high. And the donor at any point is not in any way harmed by giving a stem cell donation. Whether you're a 6-month-old baby or a 60-year-old person, the donor doesn't get harmed in any way, but they can help save a life, and the stem cells are made back in your body within a week to 10 days. So the transplant procedure is tough for the patient. Whichever donor we choose, whether it's family donor, it's unrelated donor or half-match donor, they have to go through this rigorous procedure of chemotherapy, having the new stem cells, waiting for the new stem cells to be accepted by the body. So there is about a 4 to 6 week period of struggle. But at the end of it, they are able to defeat a blood condition which is lethal and get cured. Obviously, because we've given them high doses of chemotherapy or radiotherapy, they will need close follow-up. Up to 1 year, there will be medications, but children like they're going to do beautifully in the future, have no late side effects because we are designing chemotherapy in such a way that they don't have late side effects and are able to lead a normal, healthy life. I wish her all the very best, and I hope that they spread the message of hope to all around.